Hello and welcome everyone. Again, it is my pleasure to introduce Dr. Shruthi. She has secured the first rank in the INISS exam. And I mean, it's now become a very great thing for us because we keep doing infectious diseases toppers interviews. So I would ask Dr. Shruthi to, introduce herself and also walk us through her experience so far.
Right, sir. Hello, sir. And it's a great pleasure to be here with you. And my name is Shruthi, and I'm from Hyderabad. I did my undergraduation in CMC Vellore, and following that, I had 2 years of service period where I worked in the departments of anesthesia. This was also when COVID had hit, so I was working in the COVID ICUs as well during both the peaks. And following that, I did my post graduation in medicine in Sir Gangaram Hospital in Delhi. And I just finished my course in October.
Right. And why do you think, you're good for ID or ID is good for you? Like, what made you think about infectious diseases?
Yes, it's been a very long journey with ID. So I've been loving it and nurturing this passion since almost, I think, 10 years now. It started, I think, in my third year when I was involved in a research project with our community medicine department. This was a project where we were looking at the socio-economic impact that TB had on the family members. That is, somebody in the family had TB, and then how is it affecting the others for the next 5 years? And like academically, I knew the results. I was expecting, of course, a negative impact. But what I saw, and when I was speaking to the people and speaking to the family members, it was really bad. The amount of financial crises they were facing, the social exclusion that they were facing, the children were dropping out more, a lot of malnutrition. And this actually prompted me towards reading more towards social justice and health equity and how it relates with respect to infectious diseases. But I think what really nailed it in the head was COVID for me. This was when I was working in the ICUs and people were just so sick, and especially in the second wave, when a lot of people, not just young people, but just so many people were dying, and we just could not offer them the gift of time because there were no resources, they did not have money. And this is when I realized that outcomes can be so different, not just because of the biology, but because of the systems as well. And this prompted me to keep reading and reading about how health equity can be integrated. And that is when I came across Dr. Paul Farmer's work. If you must be knowing, but he's an ID physician who worked in Haiti and Peru. This was back in the 80s, and he actually really put developing nations on the global map. And he proved that drug sensitive, drug resistant tuberculosis also can be treated at a very high cure rates. And this was actually after this, when they presented this data, when WHO put MDR-TB as something worthy of treating in developing nations. So his journey actually, and his and so many other amazing Indian physicians also, they showed me that a well-meaning ID physician can really transform health globally. And I feel ID is already such an amazing subject, and it is, I feel like, the crown jewel of medicine. But it's also at this intersection of clinical excellence and social justice, and I feel this is where I can contribute a lot to ID.
I think that's one of the most brilliant answers that one can think of when you think about infectious diseases, because a lot of people I've spoken to, in fact myself, most of the times I do think about the clinical aspect of infectious diseases. But yes, you're so right when you say that so much of social justice and everything is somehow related to infectious diseases. I mean, it goes on and on. It's not just TB, it is disease like HIV and so many other infections, and the kind of impact these things have. So I come across cases on a regular basis where a patient outcomes were not good just because an infection was not managed properly. Not that it was not manageable, it was just it wasn't just managed, like a surgeon does a big surgery, like everybody hails the surgeon as the hero. I mean, with all due credits, if the post-op care, it can always get complicated by infections, and you can always make, sure that the outcomes are still good if infections are managed properly. I mean, it's a daily occurrence. So many smaller centers keep performing procedures, which they should. I mean, in a country like ours. But again, managing infections shouldn't be limited to, or ID specialists shouldn't be limited to, big centers, referral centers, which is the case as of now. Because we have to be honest, like, I come across people everywhere. I mean, I'm just started working, right? There's so many experienced people in different branches. And I keep telling that, ID is not one person's domain. Everybody needs to know how to manage infections. And if you're not sure, just ask someone else, because these are one of the curable things, right? And once you cure it, life goes back to normal. People
Yes.
start living their normal lives, they start earning their livelihood. They don't have to go back to the doctor again and again, be it MDR TB or DR or DSTB, anything. I mean, that's great. But also, like, in addition to your undergrad work and the readings, the things that you have read, apart from that, like during your post graduation, any inspiration, any experience of working with ID physicians at your postgraduate level?
Absolutely, sir. Like what was in theory and all this philosophies for me that started at the beginning, that actually was put to test in residency. And so when I started off, we just had it was just medicine department, and then we had Dr. Anvita who joined us, and then Dr. Gogi and Anvita. They both set up the ID department at Gangaram, but they were also working along with medicine. So we were very lucky to be seeing all of their consults and working with them very closely. And they both are storehouses of knowledge. And pretty much actually, since Gangaram was a super specialty hospital, a lot of the cases that medicine per se was admitting was also infections. And so a lot of exposure and actually first-hand experience in handling a lot of these patients.
Right. I mean, internal medicine is anyway the core branch, right? Every case can be managed under internal medicine. It just requires a little bit of tweaking here and there, because even everything is evolving a lot. Even infections are evolving. Management principles are changing. Now, earlier things that were as simple as, match the drug sensitivity report and just give an antibiotic, it doesn't hold true anymore. You have to still think about the best combination when you're dealing with drug resistant infections. Or if you have a drug sensitive infection, appropriate de-escalation, choosing a good oral antibiotic, determining the duration of antibiotic. I mean, all of that can be done on a very random basis, and still, you might see success. But as physicians, as trained experts, we should try to, do the best possible treatment, the shortest duration drug, the best suited drug, instead of just giving meropenem for everything, when you can manage with something like, say, Septran or minocycline, right? So I'm sure, like, a lot of people will be listening to you or this interview, and they might see more perspective, through you. The other thing I wanted to ask is your experience regarding preparation for the exams, and how do you rate the exams this time? What pointers do you think would help other people?
Right, so this was my first attempt, and I had never, not even given actually much mocks. So I just whatever I knew of the exam was from the Marrow interviews and from actually talking to the previous the toppers and the residents from AIMS. So I knew that the basic structure was 50 plus 30, 30 medicine and 50 to 60 sometimes of ID, including micro. So this time the our paper was actually very clinical. I would say even if there was microbiology, it was largely integrated with a case scenario or a patient scenario. So I think that was a huge upper hand for me because uh, I don't think the amount of prep I put in for this exam. I think much more than that, what helped me was all of my previous clinical experiences and actually seeing patients and having actually those very specific caveats in dealing with those ICU patients. So I think I would say all of my training for this exam would have started in my residency and just seeing patients closely at the bedside and reading guidelines at that point, understanding how do we, like you mentioned, tweak around with medicines. So that helped a lot. Because I finished my course in October, so I did have time, but I did not allocate so much time for this exam. So I mainly focused on completing the question bank and ID of the ID subject Marrow. Whatever topics which I felt a little underconfident, like maybe NTM and certain other topics. Those were the ones I quickly went through the notes, but I largely completely focused on the question bank. And the last couple of days, I just had some microbiology notes from my junior, so I just went through that. But I must say, micro part is actually covered both in the notes and in the question bank. So it felt more like a revision than actually reading it for the first time. And as I mentioned, sir, the papers of the medicine part, I actually did not prepare. I was just counting on my DNB prep, and it was actually
Correct.
quite straightforward, the medicine question. So I think most of the candidates felt that, so we could approach the medicine part pretty easily.
Right. And by notes, you meant notes on Marrow. You prepared your
Notes on
own.
Marrow, sir.
Okay. The same,
Yeah.
the ones that were circulated. Okay.
Yes, the ones along with the videos.
Got it.
Yeah.
And did you find the videos to be useful, and also any areas that you feel should be covered a little, better in these videos?
So the videos actually helped me the most when I was preparing for interview, because that's when like really getting down into the theory. And I must really commend you, sir. And this is something that my consultant used to say this about you, that you have this art of summarizing very complex topics very beautifully. And I think ID, where so many of the topics are, you can just go into any amount of detail
Yeah.
to actually compress it and really highlight on the important points. I think you did that very well. So that helped me a lot in during the 1.5 week we had for interview. That's when I actually did most of the videos. With respect to the topics covered, so I think almost everything is pretty well covered. Everything that is relevant for the exam, at least. And actually, they asked. I think the level is much higher in Marrow than what is actually asked in the exam. Maybe I just felt that rickettsial infections was something I could not find so much. It wasn't asked a lot anyway in the exam, so I don't know how relevant it is. But maybe that is one area we could focus. And definitely, I think it would also be better to have just a brief, rapid revision of microbiology, sir. Maybe just some notes or one video.
Right. I mean, rickettsial infection is really very important. So we do plan to cover it along with our, residency videos and all. Microbiology part, what I try to do is I try to refrain from covering microbiology because I'm not a microbiologist, for example, right? What we keep trying to do is I'll again talk to the team, if microbiology section or the microbiologist at Marrow, if they could summarize something for students. I mean, I can always do it, but it will be just like reading and jotting things down. As of now, what I know is clinical applications of microbiology, rather than microbiology per se, right? Again,
Sir, but I must
microbiology.
say, sorry to interrupt you, sir. You do actually cover all the relevant microbiology in the topic, so I actually feel that is enough. It's just to have just a one stop for all and just
I
have a quick
understand.
revision at the end.
I completely understand. The other thing is microbiology itself is a huge subject, like, so ID is like two huge subjects combined together. It's like medicine as a whole and microbiology as a whole. Plus you add infection control, stewardship and everything. It's actually a huge subject. So it's not possible, like even when you start working and all, like for example, I work right now, it's not possible to actually cover every base, even as a subspecialist. But anyway, we are working on it. We'll try to make better capsules for such kind of things. And the last thing I wanted to ask is, so now that you have secured rank one, right, and you have the option of choosing AIMS Delhi, so what are your plans? Like, you're fixated on AIMS Delhi, you're still looking at NEET SS, or you have other things going on in mind?
So I'm going to choose Delhi, sir. And I definitely will be giving NEET SS, but the options are quite limited over there also. And so I've decided I'll go ahead with this.
Right, right. I mean, it would be great to have you there. I mean, you'll become a part of the same alumni group. You learn a lot. I mean, the peer group learning is maximum, right? And the amount of exposure, the number of patients is like tremendous. I mean, I still just see a case, and sometimes I just remember that, I've seen a similar case during my residency. So that is how it helps. Sometimes you don't need to read about things, just that one case you have seen somewhere, or some case that your peer discussed. You didn't see even that case, but somebody discussed it with you. So all of that really helps. I mean, it was great catching up with you, right? And knowing all your perspectives. Is there anything before we close the interview, anything you want to share with other people? Anything?
I think I just want to thank so many people, sir, who've led me to this point. My family, my parents, my sister, my brother-in-law, my fiance, all of them who somehow have this unwavering confidence in me and have always had it all this while. And definitely my best friends who are just scattered all over the country. And all of my batchmates, my seniors, juniors, so much to learn from each of them and so much that they have taught me. And all my teachers from CMC, from the anesthesia department, and from Gangaram. I think most of all, the biggest teacher has been all the patients I have seen so far, who let me learn from them, and I think they are why I'm here, and they are why I want to be here.
Right. Great. I think most of us would share the same sentiments as you. But it was really nice talking to you. And once again, congratulations. And
Thank you so much,
hopefully,
sir.
we'll meet soon. Yeah.